My name is Professor Shukun. I'm Professor Shukun. I'm Professor of Physiotherapy with specialization in orthopedic, musculoskeletal, and manual physiotherapy. Today we'll be talking on muscle energy techniques as a form of treatment for sacroiliac joint dysfunction. Muscle energy techniques, how we can use muscle energy techniques for treatment of sacroiliac joint dysfunction. A lot of therapists have expressed their concern about the physical nature of some of the thrust that we use in manipulative thrust, and they have a little bit of challenges, especially when the patient is on the bigger side compared to the size of the therapist. So there is also a need to describe other techniques that are simpler to use or that could be used to complement the manipulative thrust, the mobilization and the manipulation that we have already discussed in our previous videos. So today we're going to be talking about muscle energy technique. But before we go to the technique, let's give a little description or definition of muscle energy technique. What is muscle energy technique? Muscle energy technique, simply put, is using the energy from the muscles, right? It's using the energy from the muscle to relieve pain in the joints and to relax the muscles over the joints. What sort of energy are we talking about? The energy of the muscle in terms of isometric contraction. We make the muscle to contract isometrically. We utilize that energy to relieve joint pain and then to relax the muscle. So in a simple term, that is what muscle energy technique is all about. So if we have a patient that is having sacroiliac joint dysfunction, and we have been able to confirm, maybe using the Mackenzie approach, to know that posterior rotation, which is nutation, eases the pain. What we said in one of our previous videos is that you can give a home program. Ask the patient to do that movement 10 times every 2 hours. But in addition to that, we can also do muscle energy technique using the approach called spine bilateral sacral flexion technique. Spine bilateral sacral flexion technique. What does this involve? I will get Yusuf, who I would have preferred something a bit lower than this. I'll get Yusuf in this position, rolling to the side so that my hand can go to the sacroiliac joint, rolling to the side so that my hand can go to the sacroiliac. But before that, Yusuf is going to flex his knee to an extent. So my hand is here, and my hand is on the sacroiliac joint here. This will be better illustrated if I have a lower plate. Then what I will do is that, feeling the Yusuf sacroiliac joint at the bottom, right on my hand, I will move his knee a little bit further until I'm beginning to feel the movement in the sulcus. Now I've moved his knee from this position to this position, and exactly at this position I can feel that something is moving under his sacroiliac joint. So that will be the right position for us to start the isometric exercise. So at that particular position, I will now ask Yusuf to gently push his leg away from me and hold it. 1, 2, 3, 4, 5. Relax. When Yusuf is pushing his leg away from me, the muscles over the sacroiliac joints are in isometric contraction. And that is the muscle energy technique. We want to use that contraction to relieve the joint pain and relax the muscles over the joint. So can we go again, Yusuf, please? Gently push it away from me. 1, 2, 3, 4, 5, and relax. So the prescription is to push away for 5 seconds, relax for 2 seconds, repeat it 10 times, and carry it out 3 times. So it is 3 sets of 5 second hold, 2 second relax, and 10 repetition. This particular one is called spine bilateral sacral flexion muscle energy technique. Now we can do the reverse in supine. Yusuf, can you lie supine now? If, for example, we find out that Counter notation is what ease the patient pain. All right? If we find out that counter notation is what ease the patient pain, or repeated anterior rotation, according to Mackenzie, is what eases the patient pain, then we can place the patient in half prone position, whereby the patient is resting on his elbow. We will identify with my cephalad hand, I will identify the sacroiliac area where the pain is, and put my hand on it like that, and use this other hand on the ankle, and ask Yusuf to take a deep breath in slowly. As Yusuf is breathing in, there is a tendency for the sacroiliac joint on the affected side to rise up, to move superior. So what I'm going to do as he's breathing in is to resist the uprising of tissues in that sacroiliac joint area. So I'm going to repeat that again. The upper hand is on the affected sacroiliac joint area. The other hand is producing a counter force. It's producing a counter force on the ankle of the patient. So you should take a deep, slow breath. In. So as he's doing that, I'm applying a resistance. Now you're going to move back. Now you should, before you relax, when I say breathe out, before you breathe out, you move up a little bit and relax. And then we'll repeat that again. Can we repeat the whole cycle again, please? Now let's go back. Now we're about to go down. Breathe in and out. Breathe in and out. Now breathe in and out. Okay? This particular technique will be good for patients whose pain is eased by counter notation. And this technique is called prone bilateral sacral extension. The prescription is the same thing. The patient should normally hold it for 5 seconds, or as much as the patient could do, because it has to do with breathing. 10 repetitions and 3 sets. Prone bilateral sacral extension muscle energy technique. The next technique we want to show is called prone direct method. No, you're still going to lie prone. You're going to lie prone and hug the plates. No, lie prone properly, don't worry. This is going to be the starting position, all right? If the sacroiliac joint problem is in this area, then the therapist will stay here. I will ask you to lift up this one. Lift up, no, just lift up your hip joint a bit. Then I'm going to come this area. Will you be able to get this over here, or you have to come to this side? So I will come to this area. I will attempt to flex the knee and the hip of Yusuf a little bit and drop his leg by the side of the plate. I will locate the painful sacroiliac joint area with my hand here, and I will just move my hand to the ankle of Yusuf here. Put the ankles together, please. And I will ask him to push my hand, my distal hand away with the 2 ankles. Use your leg and push up, and then we'll count 1, 2, 3, 4, 5, and relax. While Yusuf is doing that, the muscles over the sacroiliac joint area are going into isometric contraction. Let's repeat that again. This hand is on the painful sacroiliac joint area. The 2 ankles are together, one on top of the other. The therapist's hand is on top of the upper ankle, and Yusuf is going to use both foot and ankle to push my hand upward in an upward direction to a count of 5. 1, 2, 3, 4, and 5, and relax. Again, this movement should be carried out 5-second hold, 2 seconds of relaxation, 10 repetitions, and 3 sets. Okay? This is prone direct muscle energy technique for the sacroiliac joint area. Then we can use lateral recumbent muscle energy technique procedure. The lateral recumbent, you can stay there. So Yusuf, we're going to lie on the side. Lie on the side and face me now. So with the lateral recumbent method, this is going to be the affected sacroiliac joint area. The patient will normally lie on the good side. Patient will lie on the good side, so the affected side is upmost. It's almost very similar to the pro direct, in the sense that we are still going to drop the leg over the edge of the plinth. But this time around, Yusuf is going to fold his hand, and my hand is going to go like this under Yusuf's arm to locate the affected sacroiliac joint area. Do we see that? Then I will use this hand to push Yusuf up a trunk until I begin to feel movement in this place. And that's the starting point. My hand will still go over his ankle. Put your feet together, one on top of the other, and I'll push my hand away. Now you can see the muscles in that area are into contraction now. Then we go 1, 2, 3, 4, 5, and relax. Okay? The same prescription, you can feel the muscles in that area going into contraction. That is another way of carrying out the muscle energy technique to the affected sacroiliac joint area. 5-second hold, 2 seconds of relaxation, and 3 sets. Pause. Muscle energy technique to the SIG area is to use seated direct method. In the seated direct method, the patient sits straddling, that is with each leg at each side of the plinth. We're going to assume that this is the affected side. This side is the affected side. That's the left side. And what the patient will do is to put his hand on the affected side on his neck or behind his occiput in that manner and move it to the front. And use the hand from the unaffected side to hug the elbow from that side. Alright? So what will the therapist do? The therapist will normally stay on the good side, right? And then grab the hand of the patient this way. This other hand is going to be placed on the affected sacroiliac joint area. Now, can you do a little chest out, Yusuf? And then I'm going to move Yusuf to a point whereby his trunk will not allow me. Don't bend your trunk, please. Just stay straight. Don't bend your trunk. I will take him to a point I can't get any more movements. So we call it restrictive barrier in manual therapy. So we are in resistive barrier now. Now, at this point, I'm going to ask Yusuf, without bending your trunk, try and move your body away from my hand, please. Go on. 1, 2, 3, 4, 5. Relax. Pause. Procedure for the seated direct method. Patient is having pain on this side. The hand on that side is on the occiput. The hand on the good side is hugging the elbow. The therapist stays on the good side. Therapist places his hand on the affected sacroiliac joint area. Hold on to the elbow of the patient. Turn the patient to restrictive barrier. Ask the patient to do a little chest out. Now, please move your elbow away from my hand. And then we go. Then the muscle here goes into isometric contraction. Then we go 1, 2, 3, 4, 5. And relax. 5-second hold, 2 second relax, 10 repetition, and 3 sets. So these are series of muscle energy technique that we can use to complement mobilization or manipulative thrust, or it can be used alone, or it can be used to complement spinal stabilization exercise in order to address the problem associated with sacroiliac joint dysfunction. Thank you very much for watching this video. Please don't forget to subscribe and like these videos. Thank you.